What is 3D printing? 3D printing, also referred to as additive manufacturing or rapid prototyping, is a type of printing first studied in Japan in 1981. The first 3D printer was created in 1984. In 3D printing, a robotic mechanism with a syringe lays down successive layers of materials to create a 3D object. The creation of that 3D object is guided by a computer-aided design software. Applications in the medical field. There are many applications of 3D printing in the medical field. One of these applications is the Wilmington Robotic Exoskeleton, which is a device used to help patients with underdeveloped arms be able to perform arm motions. Other applications include custom surfaces used to cover prosthetics, a bionic ear, and human tissue such as a reduced-size functional kidney. Researchers have a goal of eventually printing large, functioning organs with a 3D printer. Security concerns and legal issues. The biggest security concern surrounding 3D printing is the ability for anyone with a 3D printer and a design to be able to print dangerous items such as guns, chemical weapons, and military parts. 3D printers would enable a reduced cost and an increased manufacturing rate for these types of dangerous items. In response to these concerns, some 3D printer manufacturers have introduced software limitations on what items can be printed. Currently, there is a lack of legislation regarding 3D printers. Some politicians have proposed a mandatory declaration and registration of 3D printing devices. Social and ethical implications. One potentially negative implication of 3D printing is a potential reduction in the workforce required to manufacture products, since the technology involved in 3D printing is controlled by computers and not people. On the other hand, there is also a potential for the creation of new professions, jobs, and industries surrounding 3D printing. Looking into the future. The medical field has already seen numerous advances as a result of 3D printing. Some researchers believe there is a possibility of printing tissue on demand within the next 10 or 15 years. The rate of advancements depends greatly on the amount of funding received for research. Additionally, the processes and products created by 3D printing must be put through clinical trials and be reviewed by the Food and Drug Administration before they can be used by the general public.